Let's move on. We're going to start talking first about language anatomy. And I think for most of you guys who are watching this, you probably reviewed some of this in your first aid books. And I think just about every basic neuroanatomy book starts off with this. So we'll cover this, I think, relatively quickly. So the way I think of it is that information comes in. It comes in through your primary auditory cortex. It goes through your Wernicke's area. And this is the part of the brain that really takes all that outside information when you're hearing someone talking to you. It takes those words, those rules of grammar, and it makes sense of it all. So when we talk about comprehension, we're talking about your ability to understand written words, things that are said to you, and making sense of those. Next, we talk about the arcuate fasciculus. That's really most important when you're thinking about repetition. So if you have someone who's able to repeat, then the arcuate fasciculus is usually spared. And if they have difficulty with repetition, then you can imagine that the arcuate fasciculus, or maybe some of these other parts that we're looking at on this slide, are going to be damaged. And then lastly, for Broca's area, that's going to be where you want to have the physical ability to speak. So you may know what you want to say, but if you have a Broca's aphasia, as we like to call it, then you're not able to produce that speech. And when we see people like that, you can tell they know what they want to say. They're very frustrated, and they just can't physically articulate what it is they want to convey to you. And so sometimes you'll say, for me, I'll see someone and they'll be really, really frustrated. They're almost mouthing what they want to say. And then I ask them, did you want to say hi? And they'll nod their head. Yeah, that's what they were physically trying to get to, but they couldn't do it. So this next slide is basically a table, which you guys can review on your own. But the basic idea that we were talking about is those lesions we talked about beforehand. Those patients with lesions there have a loss of an ability to repeat. If they have a lesion in the Broca's area, their ability to speak or be fluent is lost. If they have a lesion with Wernicke's area, their ability for comprehension is lost. And then we talked about that arcuate fasciculus, so that's a conduction aphasia, so their ability to repeat alone is affected. The other thing that we'll talk about are transcortical aphasias. So basically what you're having here is these pink areas that you're seeing here that aren't directly on the Broca's or the Wernicke's areas, but are just adjacent to those. They can get affected, especially if you have someone with a watershed stroke. So the things that you look for that, I look for someone who's had a big blood loss, or they've had like a big surgery and they've lost a lot of blood from that. They might have these watershed strokes. And some of the other findings that you might see in addition to the language things we've been talking about, they might have proximal limb weakness. So they have something that neurologists like to call man in a barrel syndrome, because they can move their hands and they can move their feet, but they really can't move their shoulders. And my wife, who's a surgeon, asked me about it. I like to tell her, think about it as trying to watch a couple of penguins try to high five each other. They really can't lift their arms, but they're using their lower hands to do things. In this scenario too, this area, number 3, that arcuate fasciculus isn't touched, so that repetition is going to be pretty well preserved as well. So what we'll see here is that we have a lesion in this area back here. We call it a transcortical sensory lesion, or transcortical sensory aphasia, sorry. So the issue there is going to be primarily with comprehension, but repetition is spared. And if you have an issue up here, that's going to be your ability to produce the speech. So it's like a Broca's, but repetition is spared. So we call that a transcortical motor aphasia, because the motor part of the speech is affected there. So we put all that together, and we have a table that looks like this. And again, the key is that with these transcortical aphasias, your repetition is actually relatively spared compared to the other things we were talking about in the first slide. So we have this, and you'll probably see this in most of the books that you're using to study. Another way to think about it is sort of dividing the brain up in terms of the first part of the slides that we were talking about. So between this slide and the slide beforehand, those are two good ways to sort of organize the different types of aphasias for yourself. Because I think if you don't think about these systematically, you can get really lost really fast.